Hello, here we are in the latter half of chapter 6, and I wanted to go over in this particular video the start of diabetes. Okay, so on page 153 in your text, you have the diagnosis for diabetes, which we'll talk about on the next page. But basically, what diabetes is a metabolic disorder, and depending on the type, it's caused by either a lack of insulin or the body's inability to use the insulin. And either way, the result is hyperglycemia, which is elevated blood sugar or elevated sugar in the blood, excuse me. And then you have here on the slides four common symptoms of uncontrolled or undiagnosed diabetes. The first being glycosuria, which is excessive sugar in the urine, polyphagia, polydipsia, which translates to insatiable hunger and thirst, and then polyuria related to frequent urination. Um, Diagnosis, like I said on page 153 in your text, for diabetes, we can have a diagnosis either based on a lab test called a A1C. You'll also see that written out as a hemoglobin A1C or a glycosylated hemoglobin. A result of an A1C greater than 6.5. Make sure you make a adjustment to your slides here. I have greater than 65%. That would be like impossible for someone to be running around with blood sugars that high. So it's an A1C greater of 6.5%, which translates to an average blood sugar of about 150. Or if someone is fasting, then on separate occasions, it can't be just a one-time thing, their blood glucose is higher than 126 when they're fasting. And then there's also what's called a casual test or a random plasma glucose, and that is greater than 200. So that would be indifferent from whenever they have eaten last. So for instance, someone might get this result at a health fair. Maybe they just eaten lunch and they had a blood drawn and they have a plasma glucose of greater than 200. And that's symptoms. Those are those symptoms we talked about on the last slide, the polyuria, polyphagia, polydipsia, glycosuria. Then we have a condition called prediabetes, and that's diagnosed with a fasting test result between 100 milligrams per deciliter and 125. So for someone to be in the normal category, not prediabetes, not diabetes, they would have to have a fasting of 99 or lower. So let's talk about the different types of diabetes. We have type 1 diabetes, which is typically seen in younger children, adolescents, and young adults, like usually under the age of 40. This is insulin dependent. So the beta cells in the pancreas stop making insulin completely. And this is typically caused by some sort of rapid onset of fever, acute illness. It's an autoimmune disease, and these individuals need insulin to live. If the type 1 diabetes is not controlled with insulin, that's either injected or inhaled or intravenous, this can lead to coma or death. And we hear a lot about ketosis right now because of the ketone diet or keto diet. Basically, what happens here in someone with type 1 diabetes, their cells aren't getting any glucose because there is no insulin on board. So their body turns to fat to break down for energy, which sounds glamorous for many of us that are carrying around a little bit too much fat. But for someone with type 1 diabetes, that produces those ketone bodies, which can be dangerous and lead to problems with breathing, kidney, other organ failure, so can lead to coma or death. So oftentimes we'll hear the abbreviation DKA, that's diabetes ketoacidosis, and that is extremely high blood sugars, high levels of ketones in the blood, and putting someone at great risk for organ failure and death. So we see then type 2 diabetes, which is the most common. This is the type of diabetes that typically occurs because we're inactive or carrying around too much weight. We have a family history, or we're from a racial group that has a greater risk for type 2 diabetes, like Asian Pacific Islanders, Native Americans, Hispanics, and African Americans. treatment for type 2 diabetes may require insulin.